Hi, I'm Kate Cruz, and I'm the area pharmacy manager at Providence St. Joseph Hospital in Eureka and Providence Redwood Memorial Hospital in Fortuna. And I'm here to talk to you today about our medication for opioid use disorder that we have at both hospitals. We started this program about spring of 2018 when a MAT clinic provider, medication for assisted treatment clinic provider, Dr. Malia Honda, who also happens to be a hospitalist at our hospital, came to us to discuss starting up a program for patients who were in the hospital as inpatients for various reasons, but who also happened to have opioid use disorder and who could benefit from starting treatment inpatient while they were already there as an inpatient. So we started that program. We provided education to hospitalists and nurses and pharmacists, and we made it easy for hospitalists to be able to order the buprenorphine treatment for opioid use disorder, and we provided them an easy way to order it and to start up the treatment for the patient in order for them to transition into an outpatient MAT clinic after they were discharged. We then soon applied for a grant through the California ED Bridge and Public Health Institute. And we received that grant, which was started in February of 2019, which provided funds in order to hire a substance use navigator. We hired that substance use navigator, Yvette Cernum, in the fall of 2019, and she started off on the ground running. And with her manager, Joy Victorine, who is manager of Care Network at the hospital, we've been able to have a great program in the ED Bridge, which provides a quick start of buprenorphine before transitioning them to outpatient treatment. However, the transition to the outpatient treatment really necessitates a little bit more involvement, and that's where Yvette, our navigator, comes in. She helps them, the patients who are in the ED, to help them through, navigate them through the treatment in ED, and also navigates them after they are discharged from the ED to go into an MAT clinic and helps them with whatever needs that they have in order for them to be successful. And what we have learned, both through our trainings through the California ED Bridge and by Yvette's personal experience, is that it is essential and so necessary to have this substance use navigator to really help these patients to be able to be successful in their treatment, because it's a really rough time for them, and it's really helpful for someone who can navigate through all of the different channels, and knowing where to go, who to go to for their treatment, and thereafter, and how to get to these treatments. So it's just Yvette's been very, very busy, and very appreciated by ED caregivers, nurses, and physicians, and the ED really appreciate her, as well as, of course, the patients who really appreciate her kind words, her empathy, and her ability to help them through a pretty rough time. Some challenges that we've had in this program is it is difficult to overcome the stigma that these patients have in the setting of the treatment, quick start treatment in the ED and the inpatient setting. But Yvette has been very good, both educating providers and nurses in overcoming the stigma of these patients, as well as help them to understand what's really needed for these patients. And it's more than just the buprenorphine itself. And so it's been really great to have Yvette on board for that. Our BART team in the inpatient setting has also been very, very helpful and essential. In the inpatient setting, they really help provide the same kind of help in navigating the patients through the inpatient treatment, as well as getting them to treatments in the outpatient setting as well. We are very proud that we have a great team, the navigators through the BART system or our substance use navigator, Yvette, to really connect with these patients, and to let these patients know that they're not alone, and that we're here to help them, and that they're in a safe place to be able to get the correct treatment, the right appropriate treatment, and to be able to connect them to the treatments once they are discharged from our hospital. And that has been really essential, so that they know that they are in a safe place and that we are here who want to help them. And we're also still in, challenging challenges of after the patients, if the patients are here for opioid overdose, we of course are very good about naloxone treatment. There's still, I think, some opportunities for us to, um, in the hospital and in the ED setting, to also provide buprenorphine after naloxone has been given, so that we're not just treating the the why the patient's here initially for the opioid overdose, but to also treat them long term and to make sure that they have long term treatment so that we can avoid the overdose from happening in the future. So that's an opportunity for us to provide education and service to providers and nurses on that as well. And if you have any other questions regarding our program, please feel free to contact me. Again, my name is Kate Cruz, and you can reach me at my hospital phone number. It's 707 445 8121 extension 6206. Or you can email me at kate.cruz@stju.org. And I thank you so much for taking the time to listen to what I had to say about our program. We're very proud of our program, and we are so proud to be able to help these patients in need. Thank you very much. Have a great day.